Of Knoxville anticipates sealing a deal now with Tenova to buy the former St. Mary's Hospital property.
That's right. The deal still not finalized tonight with just over 24 hours until that hospital and another Tenova facility close their doors. Those hospitals, Physicians Regional Medical Center here in North Knoxville and Lakeway Regional Hospital in Morristown, they are both closing tomorrow night with 1 minute to midnight.
Now, the wind down process already underway. Both hospitals, we've learned, have stopped taking new patients. Live coverage for you. WATE 6 on your side reporter Blake Stevens joining us tonight from Physicians Regional. And Blake, do we know more now about what's next for the hospital?
Well, Bo, we know that the city has been eyeing this hospital since September as a possible site for a new Knoxville Police and Knoxville Fire headquarters. A spokesperson for the mayor's office telling me today that he anticipates a deal with Tenova to go through, but nothing is finalized yet. But the city putting out this request for qualifications. They are looking for architectural and engineering design services. The RFQ describing the job as converting an existing campus of multiple buildings into a new public safety complex, which includes renovating 190,000 square feet of interior space. No matter what happens with the city, 88 years of healthcare here is coming to an end. First opening here in Knoxville, April 22nd, 1930. The Sisters of Mercy and a group of Knoxville doctors coming together to ask the Diocese of Nashville for a Catholic hospital. Despite the Great Depression, fundraising efforts were successful, and the hospital still standing today.
And I noticed that hardly any helicopters in the last maybe 2 months, so I knew the time for it to close was drawing near.
Deborah Zarette is sad to see the hospital go, living 2 blocks away, but she knew the day was getting closer.
It's so close, and I actually got bit by my one dog last January, and I got stitches there at Tenova, and they treated me really well. It was fast.
A Catholic herself, Zarette proud of the church's impact on this area of Knoxville and optimistic about the hospital's future.
I just enjoyed going to the lobby when I was a patient there and looking at the pictures from way back and the construction, how much the hospital has changed over the years, and all the nurses that have graduated from there, and especially the nuns, now called sisters. I just felt such a connection.
We will continue to watch the discussions between the city of Knoxville and Tenova Healthcare, and we will let you know if this is in fact going to become the new headquarters for Knoxville Police and Fire. We know that there is a workshop scheduled January 10th to talk about all of this, and that RFQ that I mentioned, that deadline is January 18th. And I also spoke with a spokesperson with Tenova. She tells me talks are ongoing with the company and city, and that the company is, quote, working with them on the necessary steps with the transition process. Reporting live in Knoxville tonight, Blake Stevens, WATE 6 on your side.
All right, thank you so much, Blake. Now, Tenova told us back when this move was announced earlier in the year that it was part of a strategic reorganization of services aimed at, quote, meeting the needs and preferences of today's healthcare consumers.
The company telling us that capacity is growing at its North Knoxville Medical Center and Turkey Creek Medical Center campuses. At Turkey Creek, that means more beds, more operating rooms, and a new cardiovascular intensive care unit, which is set to open in the spring. At the North Knoxville campus, Tenova has renovated and reconfigured existing space. That's on top of moving surgical robots there from Physicians Regional.
Also, Tenova has been enhancing services at affiliated hospitals in La Follette, Jefferson City, and Newport. Tenova's area CEO, Tony Benton, saying in a statement, quote, "We have been working very closely with our medical staff, local EMS, first responders, and other area providers to ensure a smooth transition of care for our patients."